My name is Sarah Everhart, and today I'm going to talk to you about the issue of physician-assisted suicide. Throughout the past hundreds of years, thousands of advancements have been made in the practice of medicine. Vaccinations, antibiotics, and new methods of medical imaging and tests have allowed medicine to accomplish things that would have never been imagined in the past. Of the new medical practices we see being used in healthcare every day, one of the less known practices that has recently gained publicity is physician-assisted suicide. Physician-assisted suicide, also known as death with dignity, is suicide by a patient facilitated by a lethal dose of a prescribed drug given by a physician who is fully aware of the patient's intent. This medical practice is something that is not only gaining awareness here in the United States, but also has been a practice in other countries for a significant amount of time as well. Publicity given to this issue has resulted in a large number of both advocates and condemners who have been actively working to bring this topic into the spotlight of a very controversial debate. It is important to realize that physician-assisted suicide is a current and relevant topic here in the United States. According to an article entitled Gonzalez versus Oregon, written by the Chicago Kent College of Law, Oregon became the first state to legalize physician-assisted suicide for terminally ill patients. The legislation allowed doctors to prescribe patients fatal doses of medicine if they were terminally ill. In another article titled Legalize Physician-Assisted Suicide, the Second Year, published in the New England Journal of Medicine, written by Sullivan, Hedberg, and Fleming, it says that the legislation required patients to submit a written request, 2 verbal requests, and to have been diagnosed with only 6 months to live. Other states that have passed similar legislation other than Oregon include Montana, Vermont, California, and Washington. Before we decide which side we would like to take on this argument, it is important to realize all the facts on each position. It is important to realize that physician-assisted suicide is something that does not only affect the people involved. It plays a role in society as a whole and shows a viewpoint that would view suicide as an acceptable and honorable behavior. Although, by passing this legislation, it appears as if we are gaining rights as an individual person, we are also losing things such as the sacred relationship between doctor and patient, medical research, and light of hope in time of a terminal illness diagnosis. It is also important to consider that physician-assisted suicide is being used as an option in lieu to medical care. In an article entitled Death Drugs Cause Uproar in Oregon, written by ABC News, there is a case detailing the specific problems of a patient named Barbara Wagner. Barbara Wagner was a patient who was diagnosed with lung cancer and was told that she most likely only had 6 months to live. When her doctor informed her of a very pricey medicine that could prolong her life, her insurance refused to cover the bill for the monthly medications. Her insurance sent her a letter saying that they could not pay for her medication for her treatment, but could, however, cover the cost of the medication needed to be taken if she decided to take the route of physician-assisted suicide instead. This case shows that physician-assisted suicide will be seen as an option instead of medical treatment. By doing so, we are telling patients that not only are their lives no longer worth living, but also that we would rather pay for them to end their lives than pay to help them treat for their illnesses. Also, it is important to see how physician-assisted suicide corrupts the doctor and patient relationship. Doctors spend years getting an education to one day help care for and treat patients of all kinds of illnesses. Historically, doctors and physicians have taken the Hippocratic Oath to outline what their role will be as doctors. In the oath is a statement that specifically states, "Also, I will, according to my ability and judgment, prescribe a regimen for the health of the sick, but I will utterly reject harm and mischief." In more recent times, this phrase has been changed into the statement, "But first I will do no harm." While those may not be the exact words used, the underlying message remains unchanged. It is a doctor's job to present the patient with the best treatment they are capable of. And while in terms of terminal illnesses there may sometimes not be a cure, the best possible treatment would still not be death. Also, according to an article titled What's Wrong with Making Assisted Suicide Legal, a British study showed that 93% of these people interested in suicide were mentally ill at the time. This is important to consider because oftentimes people forget that the mental state people may be in when it comes time to make a decision such as suicide. In the same article, Osteen states that, indeed, the suicide rates in patients with terminal illnesses is only between 2 and 4%. Compassionate counseling and assistance, such as those provided in many hospices, together with medical and psychological care, provide a positive alternative to death with dignity among those who have terminal illnesses. It is important to consider the types of emotions someone recently diagnosed with a terminal illness would be feeling. From hopelessness to defeat, it wouldn't be surprising for them to want a way out. But positive support from doctors and family members can go a long way in healthcare, positive outlook on life, and overall recovery. In an article titled, "The Alternative to a Physician-Assisted Suicide, Respect, Human Dignity, and Offer True Compassion," Brian Anderson discusses the alternate routes of healthcare other than suicide. According to Anderson, palliative care and hospice care are both available to improve the condition of life for people who have been diagnosed with terminal illnesses. While it is not a cure for what they have been diagnosed with, it does allow them to comfortably live out the rest of the time that they may have left with their loved ones or friends. Physician-assisted suicide unfortunately takes this option away and ends the patient's life immediately. Rather than allowing them to spend as much time as they can with their friends and family, their lives will end and their families will be left with what could have been for the times that they could have left together. It is also important to consider the fact that while rare, medical miracles do in fact happen, so by committing physician-assisted suicide, you have no chance of making a possible recovery or turnaround in the light of your illness. What I believe would be the most important concept to consider is that physician-assisted suicide reduces incentive for medical research. Unfortunately, the realism behind terminal illnesses is that oftentimes there are no cures. And while there are treatment plans to help prolong life and improve the condition of life, actual cures to eliminate the sickness altogether are slim to none. One of the main reasons a cure for cancers has not been found is due to the variation in illness from person to person. With cancer cells changing rapidly and mutating at rapid speeds, it is very likely that the cancer found and treated in a patient one day could be very different from the cancer that they had treated from for months or years down the road. By legalizing physician-assisted suicide, we will lose very valuable research and information that could have been gathered from these illnesses. While it is unfortunate that patients inevitably have to endure painful symptoms and side effects of medications and treatment plans, each illness offers an opportunity to insight on how these illnesses work that no one else can provide. By a patient ending their life, months of symptom tracking, successful rates of treatments, and overall illness experience are lost. All in all, the cons of physician-assisted suicide outweighs the pros. Physician-assisted suicide will have long-term negative effects on our society. It will present an image that suicide is viewed as acceptable and understandable in certain situations, which is simply not the case in the medical field. While everyone has a right to their own bodies and own personal choices, the option to commit suicide is a very private and personal decision to be made. It is not a decision that should involve the assistance of a doctor who has taken on the role of healer. By allowing physicians to aid in the death of patients, we will be permanently corrupting the patient-doctor relationship that we have worked to preserve for centuries. Physician-assisted suicide will put a price on patients' lives and represent the idea that at some point, patients will have nothing left to live for, which is simply not the case. And this is exactly why further legislation to pass and legalize physician-assisted suicide must be rejected and stopped.